Hi, I hope you are well. My name is Johnny Sanchez Rodriguez. I am going to present my project for United One, and I will tell you about very important uses. Do you know what hell is? Well, I explain. Hell is defined as a state of being free on any disease, injury, element among others. The concept of hell is two realms, which have two perspectives, the narrow one and the broader perspective. I will explain what each perspective is about. The narrow perspective considers all of the accent of the disease, disability, or biological dysfunction, while the broad perspective will understand the concept of health in the broader way. As we know, the concept of health is too broad and cycle health makes up its definition is the also defined as the absorption of disease or disability, while mental health affects people in decision making or as one user. Illness and illness might be related, but it does not mean that they are the same. Illness is an objective there which implies the malfunction on the body. Illness is also the subjective experience of pain, discomfort, or as a disorder. Do you know what illness and disease are? Well, a disease is a cycle or mental disorder which involves symptoms, dysfunction of tissue damage. Chronic diseases are caused by poor lifestyles. It can also be infection by communicable pathogens. Non-communicable disease or the also known as chronic disease. These can be of long duration, such as cardiovascular disease, cancer, respiratory disease, or diabetes, among other diseases. Risk factors can be multiple and this disease, but is due to modified behavior with tobacco consumption, cycle inactivity, unhealthy eating, or alcohol consumption. You increase the risk of getting sick. It is very important to control non-communicable diseases. To control non-communicable diseases, the risk factors what are associated with the disease must be reduced. But in order to control different factors are needed, including health. It is too important to be able to prevent non-communicable disease, since if we do so we can avoid too many complications or even death. While reducing or eliminating disease factors will increase the quality of life. There are different ways to prevent a non-communicable disease. The first thing is to make sure we are as healthy as a possibility. It is to stay away from smoking, stay active, have a healthy weight, have a balanced diet, and avoid drinking alcohol. Prediabetes occurs when blood glucose levels are higher than normal, but is not enough to diagnose diabetes. The most common symptoms of prediabetes are being very thirsty, urinating too much, blurry vision, being tired more than usual. Well, diabetes is a chronic disease which occurs when the pancreas can no longer produce insulin. But do you know that is insulin? Insulin, the hormone produced by the pancreas to is has adequate levels of glucose in the blood. There are three types of diabetes. Type 1 diabetes is the autoimmune reaction in which the body's defense system affects the cells that produce insulin. Type 2 diabetes is insulin resistance, while gestational diabetes is the high blood glucose level during pregnancy. Exercise is totally vital in you have diabetes, as it helps to control blood glucose levels and weight. It also reduces the risk of a heart attack and stroke among others. The benefits of exercise are independent on the weight loss. There are 10 types of exercise that you can do to reduce risk or control, such as walking, cycling, swimming, tennis sports, weightlifting, calisthenics, yoga, among others. That will be all. Thanks for your attention.